My name is Kellilyn Hutchison. I will be comparing the Thailand healthcare to the US healthcare system. Thailand's healthcare system is a universal healthcare system that started in 2002. When it started, there was a copayment of 30 baht, which is $1 in the US. This included prescriptions. After 2007, they got rid of their copayments. And within the Thailand government, there are multiple agencies that don't have clearly defined roles and responsibilities, which has led to inefficiencies of payments, monitoring, and reporting. The US is a hybrid system. 48% is privately funded, 28% is federally funded, 17% is state funded. The rest is out of pocket by the patients. If we look at the life expectancy of Thailand, it is lower than the US, but only by a few years. The top 10 causes of death in both countries are very similar. They are non-communicable diseases, and the top two are cancer and heart disease. So both societies are going through a transition away from the communicable diseases to more of the chronic illnesses. Thailand's healthcare spending is less than the US at $228 per capita. The US is over $9,000 per capita. Now, if we want to look at the healthcare spending percent of the GDP, Thailand is at 3%, whereas the US is almost at 18%. Thailand's percent of healthcare spending of the GDP has increased. That is due to an aging population with chronic diseases. So it's costing their healthcare system more to pay for that. If we look at a healthcare system and we want to see how efficient it is, we need to look at the hospital-acquired infections. If it is low, then the hospital personnel are doing a great job at keeping infections minimum. However, in Thailand, their prevalence is about 9%. That is in public and private hospitals. Due to this, I would be worried if I went to Thailand. They have a booming medical tourism industry, so people from other countries go there to get procedures done that are cheaper than here in the US. In the US, our hospital-acquired infection rate is at 4%. The CDC says that 1 in 25 patients on any given day has an infection. That's a little scary too. Both of them definitely need to work on this, but I think the US is doing a better job at it so far. So for public health and prevention, Thailand has an epidemic of HIV. It affects almost 500,000 people in their country. Luckily, they have lowered the transmission rate from mother to child to less than 2%. However, people that are still affected are men that have sex with other men. Thailand has been using a pre-exposure prophylaxis treatment. So they're giving an antiviral treatment to people that are HIV negative to prevent HIV positive exposure. The only trouble they are having is making this accessible to multiple people throughout the country. Their country has a wide geographical variance, and it's very hard to reach everyone. The US is also having a HIV epidemic as well. Almost 1.2 million people have it here. Also here, men who have sex with men is one of the most affected population. What we recommend is personal action, so using condoms, getting tested regularly. We also do the pre-exposure prophylaxis treatment, which has been 90% effective in HIV acquisition. So we know this is something that works. However, we are also struggling with the accessibility to everyone, making sure people have transportation to get the medication, have the funding for it, and just making sure we can get it out to as many people as we need. Thailand is a beautiful country. However, their drinking water quality is quite poor. A third of the country has poor drinking water. This water comes from ground and surface water, which has pollutants It also has sewage and hazardous waste in it, which leads to contaminants in the water. There are multiple diseases associated with contaminants in water: cancer, GI diseases, and developmental delays in children. Here in the US, about a fifth of us have been exposed to unsafe drinking water due to violations from the EPA. It takes about 2 years to fix this. However, small communities like in Flint, Michigan may not afford to fix their pipes, or maybe it's from pollution and dumping. But some of it is due to the deterioration of pipes, and we need to work on getting those contaminants out of our water systems. Access to care. In Thailand, almost everyone has access to healthcare. Less than 1% is uninsured. And their payment for insurance comes from an income tax. So those that are uninsured are unable to pay for insurance because they don't have an income to subsidize it. Universal health care coverage is great in Thailand. However, getting those resources to everyone in such a wide geographical area with a lot of variances is difficult. Here in the US, we have millions uninsured. The Affordable Care Act did decrease the amount of uninsured. Those that are left uninsured are in states that Medicaid was not expanded, or they don't have jobs and can't pay for the cost of insurance because it is quite high. So unemployment here in the US has been holding steady at 4%. If we look at Thailand, it has rose to above 1%. It is still significantly less than the US. In conclusion, I believe both countries have things to work on. In Thailand, their governmental agencies need to have clear roles and responsibilities of what they need to work on to decrease the inefficiencies in their system. They definitely need to work on their water sanitation so that they can improve the drinking water quality. And I believe they should also look into alternative ways to bring healthcare to the people that are in those hard to reach geographical areas. The US, we all know that our healthcare costs need to be lowered. That could be because our unemployment rate should decrease. And that means that our insurance rate should go up and more people can get insurance coverage from their employer. We could definitely learn some things from Thailand. I personally like that they use an income tax to pay for their health insurance. That means that whatever is left in your paycheck is for you and your family. You don't have to use that money for other things. That's already taken care of. Thailand and the US both use that pre-exposure prophylaxis treatment for HIV. It's been proven effective. We just have to work on making it accessible to everyone, maybe having more clinics or dispensaries near communities where there's a high population of men that have sex with other men, maybe. So I think we can both work on that. And Thailand was able to significantly lower the transmission rate between mother and child of HIV. So I believe they're doing something right in Thailand with that. I think we can learn from that and lower our transmission rate as well. But this is a great learning experience. We can learn things from Thailand. Thailand can also learn things from us, such as working on their governmental agencies. And I believe I learned quite a bit by doing this because I can compare and contrast and see what both countries need to learn from each other. Thank you.